What is erectile dysfunction, or ED? Erectile dysfunction is defined as the persistent inability to achieve or maintain penile erection sufficient for satisfactory sexual performance. The Massachusetts Male Aging Study surveyed 1,709 men aged 40 to 70 years between 1987 and 1989 and found there was a total prevalence of erectile dysfunction of 52%. It was estimated that in 1995, over 152 million men worldwide experienced ED. For 2025, the prevalence of ED is predicted to be approximately 322 million worldwide. Erectile dysfunction, or ED, can have many causes, including health conditions, diabetes, high blood pressure, high cholesterol, heart disease, vascular disease, and prostate problems, medications, antidepressants, antihistamines, medications for high blood pressure, pain or prostate conditions, and some beta blockers and chemotherapy medications, injuries, spinal cord and nerve injuries or injuries from pelvic operations, lifestyle factors, tobacco use, being overweight or obese, lack of exercise, and a sedentary lifestyle, psychological conditions, stress, anxiety, depression and relationship problems, hormone problems, low testosterone or hormone deficiency from androgen deprivation therapy for prostate cancer. Other causes, chronic sleep disorders, multiple sclerosis, and performance anxiety. Age appears to be a strong indirect risk factor in that it is associated with increased likelihood of direct risk factors, some of which are listed above. Accurate risk factor identification and characterization are essential for prevention or treatment of erectile dysfunction. When to see a doctor? A family doctor is a good place to start when you have erectile problems. See your doctor if you have concerns about your erections or you're experiencing other sexual problems such as premature or delayed ejaculation, you have diabetes, heart disease, or another known health condition that might be linked to erectile dysfunction. You have other symptoms along with erectile dysfunction. What are the treatment options? Specific treatment for erectile dysfunction will be determined by your doctor based on several factors, including your age, overall health, and medical history, the extent of the disease, your tolerance for specific medications, procedures or therapies, expectations for the course of the disease, and your opinion or preference. Some of the treatments available for ED include: medical treatments include several options. First, there's sildenafil. This is a prescription medication taken orally for the treatment of ED. It works best when taken on an empty stomach, and many men can get an erection within 30 to 60 minutes after taking the medication. Sexual stimulation is required for sildenafil citrate to have the best efficacy. Next, we have vardenafil. This drug has a similar chemical structure to sildenafil citrate and works in a similar manner. Then there's tadalafil. Studies have indicated that tadalafil citrate stays in the body longer than other medications in its class. Most men who take this medication find that an erection occurs within 4 to 5 hours after taking the pill due to its slow absorption, and the effects of the medication may last up to 24 to 36 hours. Another option is avanafil. The FDA recommends that men follow general precautions before taking a medication for ED. Men who are taking medications that contain nitrates, such as nitroglycerin, should not use these medications. Taking nitrates with one of these medications can lower blood pressure too much. Additionally, men who take tadalafil or vardenafil should use alpha blockers with care and only as instructed by their physician, as they could result in hypotension or abnormally low blood pressure. Experts recommend that men have a complete medical history and physical examination to determine the cause of ED. Men should tell their doctor about all the medications they are taking, including over-the-counter medications. Men with medical conditions that may cause a sustained erection, such as sickle cell anemia, leukemia, or multiple myeloma, or a man who has an abnormally shaped penis, may not benefit from these medications. Also, men with liver diseases or a disease of the retina, such as macular degeneration or retinitis pigmentosa, may not be able to take these medications, or may need to take the lowest dosage. It's important to note that these medical treatments should not be used by women or children. Elderly men are especially sensitive to the effects of these medical treatments, which may increase their chance of having side effects. Hormone replacement therapy is another option. Testosterone replacement therapy may improve energy, mood, and bone density, increase muscle mass and weight, and heighten sexual interest in older men who may have deficient levels of testosterone. However, testosterone supplementation is not recommended for men who have normal testosterone levels for their age group due to the risk of prostate enlargement and other side effects. Testosterone replacement therapy is available in various forms, including a cream or gel, topical solution, skin patch, injectable form, and pellet form placed under the skin. Penile implants are also used to treat ED. There are two types of implants. First, the inflatable penile prosthesis, which is a 3-piece hydraulic pump. A pump and 2 cylinders are placed within the erection chambers of the penis, which causes an erection by releasing a saline solution. It can also remove the solution to deflate the penis. Second, the semi-rigid penile prosthesis. 2 semi-rigid but bendable rods are placed within the erection chambers of the penis, which allows manipulation into an erect or non-erect position. Infection is the most common cause of penile implant failure and occurs less than 2% of the time. Implants are usually not considered until other methods of treatment have been tried, but they have a very high patient satisfaction rate and are an excellent treatment choice in the appropriate patient.